Lead poisoning can permanently affect children's growth, behavior, and ability to learn. If you live in a home built before 1978, it could contain lead-based paint. Lead-based paint could be found under newer layers of paint, under wallpaper, and even in varnishes such as wooden floors and wood trim. If you plan to repair or renovate your home, the work should be completed by a certified lead professional. If you plan to complete home repairs on your own, here are some steps to follow to help protect you and your family from lead. First, you should always assume there is lead-based paint in homes built before 1978. This means you should use lead-safe methods for any repairs or renovations. Using plastic to seal doorways and vents to keep lead dust from spreading. Covering floors, counters, and furniture that cannot be moved out of the work area. Covering the ground under your work area when you are working outside. And keeping young children and pregnant women out of your home when making repairs. Methods such as dry sanding, open flame burning, or power washing create harmful lead dust. Instead, use methods like wet sanding or wet scraping to reduce lead dust. If you use power tools during your repairs, make sure they have a HEPA filter vacuum attachment. To clean your work area well, you should also use a vacuum with a HEPA filter to clean up dust and debris on all surfaces. Use a wet mopping method on all surfaces and repeat until areas are clean. Then dispose of used mop water down the drain. To finish, give your work area one final rinse with clean water and a clean mop. Protect your skin, eyes, and lungs from lead dust by wearing long sleeves, gloves, safety glasses, and a respirator. However, lead dust can be carried on your clothing, skin, and shoes. When you leave your work area, lead dust can spread to your furniture, carpets, and even infant car seats. Wash your hands, body, and clothes immediately after working with lead and before touching children or pregnant women. To test your child for lead, talk to your healthcare provider or local health department.